Good evening, everyone. Thank you for joining us for the last of our series on lung cancer awareness, which is supported by Pfizer India. Today, we will talk about how to manage advanced lung cancer. We have talked in the past about a few aspects of managing lung cancer, and I'll just remind our viewers about that in just a minute. Today, we are very privileged to have with us Dr. Ankit Batra, who is a senior consultant medical oncologist at Research Cancer Institute, HIMS, SRHU, Dehradun, and we will soon be joined by Dr. Suhas Aagre, who is consultant medical oncologist at ACI Kambala Hill Hospital and LH Hiranandani Hospital in Mumbai. And in the last few weeks during the month of November, which is Lung Cancer Awareness Month, we have talked about understanding and navigating treatment options. We've talked about risk, symptoms, and treatment of lung cancer. We've talked of challenges of dealing with advanced lung cancer. So you can find all of these live sessions that we have done on our YouTube channel, and you will continue to find them, that and some of our other content on the channels. And as some of you may be aware, Patients Engage is an online platform for patients dealing with chronic diseases. Our whole objective is to allow people to share their personal experiences so that people can learn from each other, as well as learn from healthcare professionals and allied services. And we strongly believe that the better informed we are, the more engaged we will be in managing our health, and we will make better decisions. And we'll also realize that we are not alone in this journey of coping with these conditions. We've always put patients and survivors at the center of healthcare, and we've talked to various patients over the years. And again, you will find all of these conversations on our website as well as on our YouTube channel. This session is being supported by Pfizer. It's meant for information and awareness purpose only. It's not a substitute for medical advice. So depending on the information you gather from this conversation, please do consult your doctor for guidance or directly reach out to the panelists that we have here. The views expressed in the video are the speaker's independent views, and neither Pfizer nor Patients Engage may necessarily endorse them. And I'm Aparna Mittal. I'm the moderator for this session and founder of Patients Engage. If you are if you have a question, we've already received a couple of questions earlier, and we will address them in this conversation. But if you have any more questions while we are live, you can post them on Zoom if you're logged in, or on our Facebook channel or YouTube channel. We are currently live on Facebook, YouTube, and LinkedIn. And you can always write to us at editor@patientsengage.com or through our website, patientsengage.com. And welcome, Dr. Suhas. Thank you for joining us for this discussion. Can I just do a quick audio check, Dr. Suhas? Can you hear me, Dr. Suhas? Dr. Suhas, can you hear me?
Yes, yes.
Okay, all right, thank you. All right, so we will just get started. As again, our viewers are aware, lung cancer is one of the most common cancers in men and women now. It affects smokers and non-smokers and is often diagnosed at an advanced stage. But no more advanced stage diagnosis means that there are no options available. So I think it's important to reiterate that there are options available for people to navigate this period as well. So Dr. Ankit Batra, I'll start with you. If you can quickly summarize the stages of lung cancer and what is considered advanced stage.
Yeah, so very good evening, everyone. First of all, I would like to thank Patient Engage for organizing these kind of webinars so that we can empower our patients about the disease and can give them better information. So as you asked, ma'am, there are four stages of lung cancer: stage 1, stage 2, stage 3, and stage 4. And usually the stage 3B or 3C along with stage 4 are considered as advanced lung cancer.
Okay. And when you say stage 3 or 4 is advanced lung cancer, what does that mean in terms of, from biology or the spread of the disease perspective?
So basically, if we speak about the advance, so that it has grown up, it has spread to the regional nodes, or it has spread somewhere else in the body, maybe even to the bones or to the contralateral opposite side lung, or to any other organs of the body, which can be the liver, adrenal glands, brain, or anywhere else. So it has grown inside and then spread to other parts of the body, so that it cannot be treated with either just a simple surgical treatment or any localized treatment in terms of radiotherapy or any other treatment.
Right. Thank you. And Dr. Suhas, you know, we typically say that we get late diagnosis of lung cancer. Can you kind of talk of, specifically in India, what are the stages? What stage do we end up typically diagnosing and why?
So basically, if we see the lung cancer, majority of the cases are maybe you can say almost around 80% of the cases will be diagnosed in these advanced stages, as we have been hearing from Dr. Ankit. So major means you would be surprised to know why such a late diagnosis or why such a late presentation. And as we know that any of the cancer, when it is diagnosed in early stage, the chance of the cure would be high. And suppose as long as we are getting delayed in the diagnosis, and obviously the outcomes will be not in that kind of favorable as compared to the early stage. So there are some of the reasons that do favor this late diagnosis of the lung cancer. So because we see the commonly the presentation or the symptoms of the lung cancer, like the cough, the having the difficulty in the breathing, sometimes the blood mixed sputum, or maybe the chest pain, and some of the other symptoms which we call it as a constitutional symptom, like weight loss, loss of the appetite. So all these can be attributed to the other etiologies, like we do have some of the chest infection, some viral infection, which can be misdiagnosed for. And then maybe we say that these symptoms might be some non-specific etiology. So the another reason in India being one of the common disease, that is the tuberculosis. So where all these symptoms more or less they are common to both these, either lung cancer or you take it as a tuberculosis. So many of the times we see the patient being presented with these kind of symptoms, being evaluated initially with the some common pathologies, and later on maybe the most of the time seeing the lymph nodes or some of the things like the cox pulmonary tuberculosis being managed on the empirical basis, and ultimately when patient don't respond, and that time it is being investigated for the lung cancer. So these are the basic factors where yes, it is very unfortunate for lung cancer just to have these non-specific symptom, which usually lead to the delayed diagnosis.
Right. Thank you. Thank you, Dr. Suhas. Dr. Ankit, what are the typical treatment options for advanced lung cancer? And you can talk about them without mentioning brand names or specific molecule names.
Yes, so for any advanced lung cancer, if we talk about specifically about stage 4, so it's not a simple one disease. It is again divided into multiple things. Like on the basis of histology, it can be either adenocarcinoma or squamous cell carcinoma. So this was the conventional teaching which we used to learn 10 years back. But now in the era of precision medicine, every patient with advanced lung cancer is to be treated differently on the basis of some molecular genetic factors, molecular mutations, which we need to test on them. So, any patients with advanced metastatic stage 4 lung cancers should be tested for these mutations, which are treatable or targetable with some or the other form of the drugs. Like if we have some mutations, we have some special targeted therapy drugs for each kind of mutations. And the percentage of these mutations varies from different types of histology of lung cancer. or on the different types of regional variations. Like, for example, the EGFR mutation, which is one of the most commonest mutations, is seen around 10 to 15% in the Western world. But in our setting, it is much, much more common, and it is around 25 to 30%. Then there are various other mutations also. And in case if we don't have any kind of targetable mutations, then we can think upon the treatment with either chemotherapy or immunotherapy, or together on the basis of some special tests which are called PDL1 testing, whether the immunotherapy will be favorable for that patient or not. And that will be decided on the basis of this PDL1 testing. So the message is that advanced metastatic stage 4 lung cancer is not a single disease. It's a mixed bag of multiple different kind of disease, and those needs to be tested to decide upon the treatment for that particular patient.
Right. Thank you. Um, Dr. Suhas, when you, so what is the understanding with these treatments? You take a treatment based on whether there is a mutation or not. Uh, how does the cancer respond to the treatment? Do the patients go into equivalent of remission, or you're just managing the spread of the disease and, kind of you're just making sure that it's not progressing?
Yes. So when we talk about these various targeted therapies and their response to the treatment, yeah, these are the very amazing responses. Maybe you can just notice once suppose the patient is having that EGFR mutation, and one would be started with the drug called as EGFR tyrosine kinase inhibitors. So that would be a tablet form of the treatment. So biggest advantage would be being offering taking a tablet pills only, not having the side effects like that of the chemotherapy and all. So it's a very convenient. Patient need not to follow up, say every 3 weekly or the similar kind of intervals. And suppose when once the patient would start on that particular targeted therapy after having detected that particular mutation, usually patient would start responding within few weeks. Say within 1 or 2 weeks, patient would be symptomatically much better. And most of the cases, if the patient would respond, in that cases we would be seeing a major changes in the patient as well as the radiological, like maybe x-ray or the similar investigation to a very great extent. So this kind of responses may be even a complete remission after a few weeks of the treatment. But just to be very precise, that this is a since we are dealing with a advanced stage 4 lung cancer, so any of the treatment is going to prolong the survival. This is not, even though we are going to see some radiologically very excellent responses, that there is no visible tumor on the imaging, patient is all fit, doing a return to the normal activities and all, but it will be a control of the disease for a long term purpose. And it is unfortunately it is not going to eradicate, or it is not going to cure it, but it will be a control, but that may be a prolonged survival, and that would give a best quality of the life to the patient as well.
Right. Thank you. And in terms of, kind of as you're going through the treatment, because we're talking of how people can manage this period effectively, what is the role of, nutrition during this period, Dr. Ankit?
So, leave about lung cancer, nutrition is very, very, very important in each type of cancers along with the treatment, because there are multiple factors because of which the nutrition is hampered or disturbed. The most important is the stress itself. The patient takes a lot of stress, the family is in distress, then there is a lot of depression itself. So that also hampers the nutrition of the patient. Then the drugs itself, the treatment itself, whether be it in the form of targeted therapy, chemotherapy, or any other radiotherapy, be it. So that also decreases the nutrition of the patient. But to cope up with the disease and with the treatment, nutrition is one of the very important treatment which we should give equal importance. It is one of the main factors which is usually neglected in most of the oncology settings. But nowadays, people are coming up with this. They are coming with the specialized onco nutritionists so that they can spend time with the patient, they can counsel them well, and according to the different needs of the different patients, various aspects of the nutrition can be taken care of.
Right. So one of the things that people go into, and it's a popular belief that, okay, we need to cut out on, sugars, and we need to cut out on certain kinds of food. What is the evidence on that?
So
Dr.
there
Ankit,
is
if you
no
could just, yeah.
significantly clear-cut evidence. Yeah, so there
Go
is
ahead.
no clear-cut significant evidence that intake of sugar will promote the growth of the cancer cells. Anything taken in an adequate quantity is good for the patient and for the treatment also. So it is absolutely wrong to say that a high sugar intake will increase the growth of the cancer cells, and the patient should continue a adequate, well-balanced diet which is being prescribed.
Right. Thank you. Dr. Suhas, in terms of exercise, what is the advice given to lung cancer? Because again, the reason we bring it up is often in India, as soon as somebody is diagnosed with something, they're told to rest. So, but we do find that there is benefit that regular exercise has. So what is your advice to your patients on exercise? Dr. Suhas?
So yes, it's a very means I think it's a myth among the patient and their caretakers that patients need to rest post treatment, post chemotherapy. Majority times we see that habits being going on, but to be very precise, even we encourage our patient to be more active. They has to lead a normal, near normal life, and they have to adopt a good healthy lifestyle like doing a regular exercises, walking and all, because we know that more activity, regular activity, that is going to help them to counteract some of the side effects, maybe like fatigue and all. So if you see, the fatigue is more common when those who used to rest, and that will aggravate. So basically having the regular activities, that will also help them to have some of the important aspects related to the diet, nutrition and all. So yes, doing a regular activity, exercises would be of paramount importance, which need to be rigorously practiced by the patient who are undergoing regular treatments.
Right. Thank you. And Dr. Ankit, in terms of things like lung rehabilitation or pulmonary rehab, again, do all lung cancer patients need to do it? Some need to do it. Again, what's the advice over there?
I think it is important for most of our patients, but we should emphasize that all of our patients should do it. Many of the patients who are going to receive, especially the radiotherapy to the primary tumor, there is a lot of inflammation and fibrosis because of that treatment. And not only radiotherapy, some patients, there is collapse in the lung because of the disease upfront. So all these patients, if we guide them properly, or if we counsel and encourage them to do exercises for lung rehabilitation, be in the form of spirometry or any other simple exercise or yoga or meditation. So that helps a lot in our clinical practice. And we, as an oncologist, emphasize on this a lot for all our lung cancer patients, and make sure that all of our lung cancer patients, even if they have completed their treatment, should continue these practices.
Right. Thank you. And Dr. Suhas, we also received a question on this. One of the big challenges for lung cancer patients is the risk of infection and pneumonia, right? So again, what is the advice for them? What can they do to prevent it? And if they do get a lung infection, what should they do to manage it?
Two most important reason for having an infection or maybe the pneumonia would be, as Dr. Ankit has pointed it out, post radiation. Suppose any patient is undergoing a radiation treatment, there would be risk of the radiation induced pneumonitis, that is the inflammation, infection. So in that cases, so we have to manage the patient. And another important risk.
Sorry, lost you, Dr. Suhas. Sorry, Dr. Suhas, we
Suppose the
can't hear you.
patient
Yeah.
Suppose the patient is undergoing a chemotherapy treatment. Post chemotherapy, there might be an particular period for where the would
Sorry,
go
we
down,
again,
and in that cases, yes.
you'll have to repeat a little bit.
The another risk factor for the having the infection in the post-treatment period would be obviously after they are undergoing the chemotherapy treatment, where body's immunity would be low, and the chances of the infection, not only the pneumonia, but other risk of the infection would be increased. So any kind of infection, if the patients are able to notice symptoms related to the either any kind of infection like having the fever, cough, breathlessness, chest pain, they have to contact their treating doctor immediately. In that cases, we have to treat them based upon the underlying presentation and the underlying factors.
So that's the treatment. Is there anything that they could do to prevent it?
So prevention, basically, if it is because of the say it is because of the underlying chemotherapy treatment, we normally do give them the WBC growth factors in the after receiving the chemotherapy that will help us to reduce or prevent the infection. And secondly, if suppose a patient is undergoing a radiation treatment, doing the regular exercises, breathing exercises, improving the lung capacities, that would again help us to reduce the risk of the infections.
And is there any role for these flu vaccines or pneumococcal vaccine to prevent these infections? I know they're expensive and not everybody may be able to afford it, but is there a role for it?
Yes, we can, because commonly these pneumococcal and these kind of infections, influenza and the pneumococcal, these are the most common infection that has been encountered. So ideally, before starting any immunosuppressive treatment, we advise our patient to receive this prophylactic, maybe this anti-influenza or the anti-pneumococcal vaccines.
Right. Thank you. And Dr. Ankit, apart from, kind of prevention of infections, and we've touched a little bit on the lung rehabilitation, what are the other supportive care needs for lung cancer patients, especially in advanced stage?
So I think first most important is cessation of the risk factors. Many of our patients have a history of smoking, so that needs to be taken care well. Because many of our patients, if they are not counseled well, they will keep on continuing smoking. So smoking cessation is the foremost important factors which need to be taken care of,
Right.
be it in the form of primary or secondary smoking or passive smoking. Then apart from this, uh, like steam inhalation, breathing exercises, as Dr. Suhas has already elaborated on, and basic healthy lifestyle and diet. So diet also we have touched upon, but even after the treatment, basic balanced nutritional well diet would help the patient to cope up with the immunity and prevent infections, and also in better healing of the side effects which have been developed because of the treatment.
Right. And in terms of Dr. Suhas, in terms of psychological and emotional support, what is the advice you give to both lung cancer patients and their family members?
So psychological stress and the resultant its effect, it remains a major challenge. Not only it is not only strictly confined to the lung cancer, but it is the story with every cancer. So whenever this disease is being diagnosed, so it poses a very great challenge to the psychologically, basically the mental well-being, the psychological social aspects. Those are being hampered to a very big extent. So maybe we can encourage our patients, our family members, their family members to be in having a keep and positive intent, maybe the positive thinking that will help us. Maybe we can take help of those patients who has been recovered, who has been cured of the, say, if it is a lung cancer, we can give them examples, or maybe we can ask our other patient who has been treated, who has been undergoing a treatment, or those who have been cured, so that they can share their stories with them, they can share their personal experiences. And I have seen that would really help us, our patient, to cope up, not only the patient, but their family members as well, during this particular difficult time.
Right. Dr. Ankit, would you want to add anything to that?
Yes, I totally sync with Dr. Suhas, because cancer does not happens to an individual, it usually happens to a family. And the stress or the psychological factors are not only because of the treatment itself. There are various other factors like the family. Most of them are thinking about the logistics, the finances, and many patients who are dependent on their family members. They also think that they are not wasting time of their children's, or because of the treatment their children's have to shift to some other city or leave their jobs. So that are the other factors which add-ons to the stress and the other distress of the family. So it's a duty of the oncologist to have a proper psycho-oncologist by their side, and to hold the hand of the patient and make them go through this journey along with by holding their hands to the during the treatment as well as after the treatment once they are survivors.
Right. Thank you. And we've talked of challenges around mental health. We've talked of fatigue. We've talked of nutrition, rehabilitation. Dr. Suhas, are there any other toxicities, long-term toxicities that patients with lung cancer need to be aware of? Anything that
So,
you would want to, highlight?
so mainly, maybe certain aspect like the maybe the post treatment, maybe the long term side effect. Like we talk about the radiation induced pneumonitis, radiation induced, some of the, or maybe the post surgical aspect, like we patient has undergone surgery for the lung tumor, patient might have a long term the chest pain that arises due to the nerves being cut during the surgeries. Nowadays it's being an lesser and lesser because of the use of the advanced technology, like where you go ahead with the means VATS, which is being called as a video assisted thoracoscopic surgeries, or maybe use of the robotic surgeries that are giving us a better age, not only just to reduce the post operative long term complication, but also having the rapid recovery, lesser post operative stay. So, similarly, maybe the we means not very common drugs which can impair, but there are certain side effects of the drug which are very rare. Let's say like some targeted therapy which can impair the heart functioning, pumping of the heart to some of the extent, but that are also very rare. Or maybe some drug like the targeted therapies which can also cause pneumonitis, maybe in very few, but maybe that remains a side effect to be watched for.
Right. Thank you. And some patients also, we've had caregivers concerned about the patient's sarcopenia and cachexia. Dr. Ankit, anything that you would want to talk about in those two respects?
Yeah, so cachexia and sarcopenia usually are seen in a very advanced stage diseases, where the systemic response because of the release of the cytokines, interleukins, the disease has been not been responding to the treatment which I've been giving. So there the patient significantly loses the weight. They are very frail, lean, and the muscle mass is also lost. So in that conditions, usually there are few drugs which needs to be add on to reduce that or to halt the process of cachexia or sarcopenia, or to decrease the pace of that. Along with that, a proper nutritional and diet counseling also helps in that. And definitely, the main treatment is the treatment of the primary disease, that is the cancer itself. If the cancer is controlled, then only the cachexia and the sarcopenia is going to be controlled for a longer term. Otherwise, with the use of the adjunct therapies and supportive care and diet, we can just delay the process.
Right, right. Okay. Um, any final comments from both of you? I think we've covered most of our questions, and I know we are kind of uh, on the time as well.
So,
Sorry, go
So
ahead,
I
Dr.
think
Ankit.
we together are doing great work for engaging the patient, empowering them and counseling them and making them better, more educative, and helping them making better decisions. But the key aspect in terms of lung cancer is prevention. uh, Almost 70 to 80% or more than that are because of the habits. Like most important is the smoking. So my message to all the viewers from your platform is that please quit smoking and prevent yourself and your family from developing a lung cancer.
Right. Thank you. Thank you, Dr. Ankit. Dr. Suhas?
So yes, smoking cessation, as pointed out by Dr. Ankit, basically. So apart from that, we have to be very much vigilant about the abnormal symptoms, like we talked about, so that we should not delay the diagnosis. So whenever there are any persistent kind of the abnormal symptoms, we should seek an medical intervention as early as possible. We should take help of the available investigation like chest X-ray, CT scan, or maybe the relevant investigation. And then even if it is an advanced stage, so we should not be feared in the present era, because we are having a battery of the treatment options that are very kind of targeted or very specific to the particular thing. And then maybe we can, even with the stage 4 lung cancer, so earlier it was a story of say few months, maybe 6 months, and that is the end of the story. But nowadays we are able to see a very long term responses, long term survival, and that too with a great quality of the life and the overall outcome. So I feel even having advanced lung cancer is not an end of the life. So definitely newer treatment options like immunotherapy, targeted therapy, they have revolutionized the outcomes related to even the advanced lung cancer. So we should not fear even about a lung cancer that is being diagnosed in advanced stages. We should seek appropriate medical help. And yes, I feel that maybe in future again we would be able to tackle with very great available treatment options.
Right. Thank you. Thank you so much, Dr. Suhas, for summarizing the entire discussion. And thank you, Dr. Ankit, for both of you for taking time to educate our audience. And as both of them said very clearly, right? So obviously the first step is prevention. And if you've done whatever you need to do in terms of prevention, but you still have symptoms, advocate for yourself and don't hesitate to investigate till you get a proper diagnosis, because an early diagnosis leads to better treatment outcomes. And as we are seeing increasingly over the last few years, that lung cancer or any cancer is not to be feared, right? So you need to understand that there are treatment options available, and we need to manage that treatment process carefully and adequately, working closely with the physicians and the treating team involved. So thank you once again, Dr. Suhas Aagre and Dr. Ankit Batra, for your time on on a late evening. So and to take the time to educate our audience.
Thank you.